Hello, everyone. Dr. Villa here. Dr. Maravik Villa Live is back today, and welcome back. I was away for a little bit, but here I am again. We have a very interesting discussion today because it has something to do with actually with our prior post, and it is called what is it called? A sudden death of unknown cause. That's very controversial, and to give you a very brief background on that, it actually started one that was in 2022 at the height of the rollout of the vaccine of the COVID vaccine. Um, Unfortunately, the videos at the time were banned, even though there were so many cases of these young athletes. They're actually just literally dropping dead. They're at the height of their games during the sports event, and at the height of their adrenaline because they're doing the sport. They're doing it right there, and they just suddenly collapse. They're collapsing left and right, and it's only now that we are actually bringing it back uh, to you, to the public, because we're allowed to post those videos. So what I'm gonna try to do right now is look at them and see what could have caused them to happen. Why these people are just suddenly collapsing, these people just suddenly dying, the young people.
We are taking our freedom.
Welcome back. As I said, welcome back. Dr. Villa, Dr. Maravik Villa Live. And today is April 12th. And so, wherever you are, good morning, good evening, good afternoon. And so, as I said, we have a very interesting topic today because it's about sudden death of unknown cause. This phenomenon started happening like back in 2022, and that was during the height of the uh, uh, the rollout of the COVID vaccine. And what's very peculiar or very unique about this phenomenon is that young people, and very healthy young people, athletes at the height of their prime, they are, very healthy, and suddenly they are out there in the field playing in their events, and they're suddenly collapsing, either dying, or when they get to the hospital, they have they have massive heart attack, or if you're not massive heart attack, actually the malignant, we call it malignant arrhythmia, that if you are not um, in the right place, then you will surely go or die. So, what are those? What we're trying to, what I'm going to try and discuss is go back to the causes. Why were they having heart attacks, or why were they having the malignant arrhythmia? Why was it happening? If you remember, actually, Dr. McCullough was the one who was discussing this like really intensely at that time. And the mechanism, or the reason why it was happening, was because the COVID vaccine was actually going directly into the heart. And we have that proof now that within few hours to few days, the mRNA are actually in the heart muscle. So you know what that means. When the mRNA or the COVID vaccine, so-called COVID vaccine, is in the heart muscle, it will start producing uh, inflammation. It will start producing spike protein, and what happened next is this heart muscle that is producing the spike protein will actually be detected by your own immune system to be um, foreign. Anything that is infected, anything that is infiltrated by something that is not supposed to be there inside a human cell, your immune system will attack that. And that's what happened. We have so many reports that came out. Even I remember there was a report or it was done by a German pathologist, autopsy or pathological examination of this young person. I think he was 26 or 28. The spike protein after a couple of doses, I think, of Pfizer, and it happened in on the second dose. uh, the body of this young person, a male, 26 or 28, every single organ was actually uh, uh, full of spike protein. Every single organ, uh, the cells of that particular organ were actually producing spike protein. And you know what that means. It's going to be a massive or a significant inflammatory event that will happen, and any organ that is so inflamed will eventually fail. And if you have multiple organs failing, then of course it will end up or it will come out to be the death of that person affected. And so, what are the other things that actually happen, aside from the heart attack or irregular malignant heartbeat? And the other thing that Dr. McCullough at that time, uh, he discussed about what's causing the malignant arrhythmia, and how does it happen when the heart goes into malignant arrhythmia. It's actually triggered by the adrenaline. And it makes sense because these people, when they drop or they pass out, they had a syncopal episode, it's at the height of their game. It's at the height of playing the sports. And so you can imagine the adrenaline levels of these people are actually very high. And then uh, the heart that is already inflamed to begin with. So everybody knows this. Myocarditis is the inflammation of the heart muscle. So even if it's a slight inflammation, you couple it with uh, a very high level of adrenaline, epinephrine, that's the other uh, name for that, then the heart will just go into a rapid, irregular heartbeat, which is called ventricular fibrillation. That if you're not in the right uh, um, environment wherein somebody can actually help you and shock you, defibrillate you, then the chances of making it alive is really is almost nothing. And so that was another one. And so when this phenomenon started happening, sudden death over here and over there, then the embalmer also came up with their own findings. And what is that? The calamari clots. We call it calamari clots, the white clots. I posted like a couple of write-ups recently about calamari clot, what it is, and um, this is another phenomenon that's being observed uh, by the embalmer. And what's happening is they try to drain the blood. For those of you who know how the embalming process is done, you have to drain all the blood. And what was happening, the blood wasn't draining, so they had to kind of examine um, the body, and they started finding this white clots. They call them white clots. So basically, it's a fibrinous white clot. Then eventually, the public learning about this also called it calamari clot because it's kind of rubbery and it's very sturdy. And they're pulling, the embalmers were pulling them out from the carotids, from the arm, from the legs, and they're really kind of long, and it's forming a cast of the blood vessel where they found them. And so you suspect that it was about the same time that those two phenomena were happening. And so now there are a lot of people, well, enough number of researchers actually looking into what these calamari clots are. And one thing that I can tell you, based also on what I know, and actually I'm trying to come up with a blood test, how to identify the people. So the calamari clot is made of like three things, major things. Number one is the fibrin. It is it's a component in your blood that is actually responsible for, forming um, blood clot, but it is for the purpose of stopping or to stop the bleeding or repair a wound or something. It's not supposed to keep on going or propagating, because otherwise, if it continues to propagate, it will occupy the entire blood vessel. It's not supposed to do that, but for some reason and for some strange mechanism, this kind of clots are actually forming. And so fibrin, that's the number one. That's why it's called fibrinous. And number two is um, is a type of amyloid that is abnormal, a very abnormal form of amyloid, but some study, not peer-reviewed study, so they're basically report that the amyloid is kind of a very abnormal fibrin as well, or fibrinogen. And then the third component is actually the spike protein. So it always boils down to the fact that the spike protein is the major culprit of producing this kind of pathology. So I am just trying to connect the two. That those sudden deaths were also related to the formation of either multiple clots, which can happen anywhere. It can happen in the heart, can happen in the brain, it can happen anywhere. Okay, and when they are able to actually examine the body, but the embalmer reported them that they are actually pulling out these white clots from the carotids, or mostly also on the legs, and but nobody, or well, I'm not 100% sure if nobody is actually looking at this in depth, or kind of actually do a histopathology of this white clot. And this is something that we still have to study in depth, but um, a lot of evidence or a lot of things coming out describing the pathology or how it is formed. And I will keep on giving you like updates on that as I see them coming. And once we know for sure that it is really made of this, that, and that, then it's going to be easier actually to prevent the formation, or we can do something to actually prevent the formation of that clot and prevent the demise of anybody. Um, there's only one thing that I want to tell you, and again, this is my clinical observation. Um, it is actually coming back. I said earlier that it was related to the rollout of the vaccine, especially after the subsequent doses. But this time, the cases that I am seeing, not so many of them yet, but the cases that are forming or having more fibrin or fibrinogen in the blood, because I started testing people, are those people having the COVID infection. After the COVID infection, it looks like they are likely to form this kind of clot. And so again, what's in the infection? It is your spike protein. So it always goes back to the spike protein, the presence of spike protein, that the pathology is actually happening. How can we prevent that? And it's very challenging. What I'm doing with the blood test of all my vaccine injured, long vaccine, I call them, and then the long COVID, anybody who has persistent spike protein, I test their D dimer, but the D dimer usually doesn't is not involved in the pathology of the white clot, because we are talking about the fibrin content. But I still do the D dimer, I do the fibrinogen level, and I'm doing the PT-INR. I'm also doing the plasminogen. And what is that? The plasminogen is actually the mechanism inside our body to dissolve a clot. And so if you have a defective clot formation, and then your mechanism to dissolve the clot is also defective, and I assume it's because of the presence of the spike protein again, then you really are going to or at very high risk of forming this calamari clot. So I also check for any deficiency in protein S and C. I don't know what's going to happen down the road, what are the correlation, but the testing, all these tests that I do, and once I've nailed it down, that what are the most useful testing or coagulation testing that I can really say this patient is high risk for that, then I'm gonna publish it, or I'm gonna discuss it again. But these are just preliminary because it's coming back. As far as I'm concerned, with my all clinical observation, it's coming back. But at least the advantage now is we know that it can form even if it's not even if it's not post-vaccination, COVID, not even not post-COVID or COVID vaccination. And so how do we, at least at this point with what we know, how can we prevent that? So we always focus, I always emphasize on the spike protein induced diseases, and therefore it will always come in that you have to detoxify. You have to lower the levels of your spike protein in this specifically, applicable to the vaccinated, unfortunately, especially those people with multiple COVID vaccine. Okay, and so you have to detoxify. I cannot overemphasize that, and you guys have to remember that the human body doesn't have the ability. We don't have the enzyme to actually what do you call this? Melt the spike protein, or it's a protein. So the process of melting it is we call it the protein, the naturation. Okay, because so basically you're just putting it into, like, making it into small pieces so that whatever cleaning system or the immune system that we have would be able to clean up, the debris. It becomes a form that can be eliminated by the body if you denature a protein. But we don't have the enzyme. We do not have the enzyme, and you can get it from plant. Nattokinase, bromelain. Nattokinase is from soy. Bromelain is from pineapple. And then obviously you take it together with the anti-inflammatory curcumin, and then anti-spike protein again, NAC. And there are other enzymes like serrapeptase and lumbrokinase, but I tend to use the plant-based enzyme, which is, I cannot overemphasize it to you. It's part of the spike protein protocol. And those people, when I test them and they also have a high D dimer, that's usually the one that is the D dimer. One thing, what information we get from that, the D dimer is actually like after the fact. That is the breakdown. You should see byproduct of red clot. They're being melted by our own mechanism to dissolve the clot. And so when the body is trying to dissolve clots, then you produce the D dimer. So it's actually good that the clot is getting melted, but it's bad because it tells you that you are forming clots, and usually they are microclots. So now, having said that, we have two types of clots: the regular clot, which is the red clot, and this calamari, very abnormal fibrinous clots that we observe in those people who unfortunately suddenly died. Okay, so again, any pathology of this kind, or any type of disease, the culprit is always like inflammation. So do everything to reduce the inflammation in your body. Do everything not to add any more toxins in your body. And very first source of toxin is basically your food. If you keep on eating processed food, you can almost say to yourself, okay, I almost set up for the white clot. So what else that can, in my community where I practice, it's all the retirees, and I can also see the significant increase in cognitive decline of people, memory issue. And so I started testing everyone for the amyloid, the beta amyloid, because I was just trying to see if there's going to be correlation between the two. And it's well known that the beta amyloid that we see in people with Alzheimer, they actually react with the fibrinogen. So whether these two are related, it's something to be researched and uh, to be worked on, down the road, because I'm seeing it. It's too early to say, but I'm seeing the increase of beta amyloid and those people without history of Alzheimer, but the beta amyloid is increasing again, unfortunately, in the vaccinated. And so they don't have family history of Alzheimer, no his personal history of Alzheimer, and yet they're producing significant amount of beta amyloid, specifically the beta amyloid 40. And if you look at their coagulation profile, they are also elevated. So that's like you know, uh, um, a risk, double risk for two diseases, the Alzheimer and as well as the abnormal coagulation, or we call it hypercoagulable state. So I am going to tell you more about that as I see or as I observe them clinically, because it's real, it's happening. And how are we going to avoid the infection? Because a lot of people, the new COVID right now doesn't give you much infection. It could be just a little sniffle or a little sore throat, unless that the person is heavily immunocompromised, and there are people like that. And I cannot overemphasize it. I'm observing this clinically. You have to doubt what I say, but the calamari clot seems to be increasing after infection, and they're not the big one, but you can see, and you can. Let me share this to you. We actually collected several samples of blood, 2 unvaccinated, and then 3 vaccinated. And true enough, all you have to do is just let it sit, and you can see the formation of that white substance that looks like a what do you call this? Like the egg white. It's forming like in the middle of that blood that's sitting, as the plasma and the red cells separate. Probably I'll get some picture and post it so that you guys can see. But it's happening. Okay? And these are real people. These are my patients who are actually getting treatment for different things. And a lot of my patients are getting treatment because of frequent infection, because of immune deficiency. Okay. All right. So, another thing is I think the autoimmune has a lot to do with it too. Plays a very big role in creating the inflammation when you have autoimmune. So everything is connected, And so that's all that I have to say today. I hope I made myself clear, because it's like running all over the place, but these are my clinical observation that you can consider to take your own precaution, and something that you can remember to take care of yourself. Okay, that's it for today. This is Dr. Villa, Marvic Villa live again, and it's April 12th. Okay. See you next time. See you next time. Bye.